Hi, this is Dr. Berardi, and today we're going to talk about facelifts. So there's many different types of facelifts, and a question came to the practice about what is a deep plane facelift. So typically when we're doing a facelift, it's because over time facial features have sagged, and a person looks aged and they want to be rejuvenated and look younger. So what's actually sagging in the face? So the skin, of course, but there's also the deeper layers, the deeper anatomy of the face that's sagging, and that needs to be addressed. We've heard the word deep plane facelift. We've heard lots of other terms like lunchtime facelift and skin-only facelift. Well, the deep plane, what they're talking about is the SMAS, and it's S-M-A-S, and you'll see that probably posted on some websites, and it's called the superficial musculoaponeurotic system. And it's the tissue that's deeper to the skin that contains a lot of the musculature, a lot of the, the structures that are actually descending in the face. So when we talk about deep plane facelift, we're actually addressing the SMAS. So what do we do with the SMAS? The idea behind a facelift is we lift the skin, we find the SMAS, and then we lift the SMAS, and the skin comes along with it. So if you ever hear a lunchtime facelift or a skin-only facelift, kind of walk the other direction, because longevity, scarring, and actual results are going to be probably not very dependable and not very long-lived. So we find the SMAS and we elevate it, or we lift it back where it used to be, and that drags all that anatomy back up to where it once was. That helps us determine how much excess skin there is, and then we take out enough skin to where there's no tension on that incision, and ultimately when you're all done, that incision is probably only noticeable by your hairdresser or something. So there's lots of ways to address the SMAS. The type of technique I do is actually elevating the SMAS and pulling that up, suturing into place and taking away excess SMAS tissue. There's also plication, which they just suture it up in a higher position. Some people, they're plicating in some areas and just filling with volume instead of addressing the SMAS in other areas. So there's lots of ways to do a facelift. A deep plane facelift is the type I do, and we're really correcting the anatomy that has descended over time. I think longevity is good. I think results are good, and it's something that gives you a more natural, youthful result. So what can you expect from a deep plane facelift? So longevity is one. Two, your anatomy turning to its most natural position. Some other types of facelifts were supplementing volume versus shifting the anatomy back to where it used to be, and sometimes unnatural looks can happen, unnatural results. So longevity, natural results, and scars that are nearly imperceivable.